Thank you, Mr. Chair. So, Mr. Kennedy, I have sat here for the last many minutes and listened carefully to your testimony. And I think actually Senator Tillis laid out so many of the ways that what you have said has contradicted yourself and others. It's, I don't even know where to start. So I'm going to start here. Over the last 8 months, you have claimed to make America healthy again. But in actual fact, you have led the charge in the Trump administration to destroy what is best in our healthcare system. And your denials and your evasion and your lies here do not change that. You are the Secretary of the Health and Human Services, yet you're trafficking in these fringe idea and discredited theories that are completely out of step with the scientific consensus. And you seem to be willing to say anything in the moment, even if it's untrue. So last time you were before Congress, Secretary Kennedy, you claimed, and I quote, "I have never been anti-vax. I have never told the public to avoid a vaccination." But in a podcast, you said the opposite. You said there's no vaccine that is safe and effective. So that sure sounds anti-vax to me, Secretary Kennedy. So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth. I mean, here's what I know. Here's what I know.
You want me to explain why, Senator? You just want to...
Actually, I want you to listen to me.
Okay, go ahead.
I want you to listen to me, because I've been listening to you. You said that ACIP is an independent panel after you stalked it with your picks. You said that you want evidence-based science, but it seems that what you mean is evidence that supports your view, not the scientific consensus. I mean, you dared to sit there and call my colleague from New Hampshire a liar when she presented you with facts that don't support your view of the world. It's incredible. But let me move on. Just last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants. You have no evidence of that because you have no evidence of a connection. And you want to talk about...
You're just saying something. You're just making stuff up.
You know, this is what you say, right, Secretary Kennedy? When someone presents you with information that does not fit...
I did not blame that shooting. I have no idea whether... I have no idea, and I never said that. You're making it up. You're twisting. Yeah, you are.
Secretary
you are being
Kennedy,
dishonest right now.
If you want to talk about mental health and gun violence in this country, if you want to talk about mental health and gun violence in this country, we should be talking about that, because that's what the parents of Annunciation School
You don't want to talk. You want to harangue, and you want to you want to have partisan politics. I want to actually solve these problems.
Mr. Secretary Kennedy, what the Trump administration is doing right now is making it harder for people in this country to get access to mental health care. So don't talk to me about solving the mental health care crisis when you are making it harder. You cut Medicaid, which is the #1 payer for mental health care services in this country. You decimated the agency at Health and Human Services that focuses on mental health and substance abuse. That's what states count on. They're cutting their services to schools as a result of that. Several years ago, in a bipartisan way, Congress came together and passed the Safer Communities Act, which made important investments in mental health care and did some important, though small, things to reduce access to guns. What do? You propose cutting that funding. This is what we're talking about in your leadership in the Department of Health and Human Services. If you want radical transparency, as you talk about, I mean, take a look at what you are doing. And, you know, I've heard a lot about MAHA today while we've been here. There's a lot of Americans, Secretary Kennedy, who trust you, who believe what you say, especially when you say you're standing up to corruption. And I think that they need to know, you apparently have a lot of influence with President Trump. Did you ask him not to roll back these regulations that are stopping the big corporations from dumping heavy metals and endocrine disruptors into our soil and water? I mean, there's no evidence that you have been even opposing that. Did you do anything to stop the Trump administration from rolling back this handout to Big Pharma that makes it easier for the big drug companies to charge more for cancer drugs? No, you presided over that. I mean, it's stunning, really, what's happened over the last 8 months. It's stunning to me. And I just hope that in this moment, our colleagues, there's hardly anybody left in this room, are going to think about what it is that you've done, what your legacy is going to be at the Health and Human Services Agency, and pay attention to the damage that is being done here.